Number one, differentiate between facts and concepts. Facts are those that you need to memorize. Concepts are things that you need to really understand. Most often, the basic sciences are based on facts. What I personally do is make some notes so I can refer to them the days before the exam for facts. However, for concepts, where you apply these facts to solving questions on exams like USMLE Step 2 and Step 3, you need to spend some time to understand the concepts. Number two is a common problem I used to see during my MBBS. People used to read for USMLE from page to page. This is not very helpful because what you need to do is focus on high yield topics and not read everything in the book. This is a crucial step many people tend to miss. The books can be a lot and you also tend to forget what you read if you read the whole textbook. This is important to build foundation, but for an exam, you typically need a different strategy. Number three is focusing on one topic or content area. For example, let's say you're reading cardiac physiology. It's important to connect cardiac pharmacology, cardiac pathology, and then how to apply these principles into answering questions related to internal medicine and cardiology. So think vastly and don't restrict yourself to just one subject. Ultimately, you're increasing your own knowledge because you're the one writing the exams. Number four is lack of consistency. This we see to be a very common problem with many folks. People get really excited, they read for a week, they take a break, they're tired for 2 weeks, 3 weeks. This is not going to work. This is just like exercising, playing an instrument, learning music. You have to be consistent with what you're doing and try to plan in such a way that your consistency doesn't get affected. Number five is lack of guidance or mentorship in proceeding in a systematic way. Do you need mentorship? Probably not. But does it help you? Absolutely yes. In fact, even the American Medical Association says that IMGs who have mentorship and guidance are more likely to succeed than who do not. You can obtain mentorship from someone you trust or someone like us who have extensive experience in mentoring hundreds of international medical graduates like you. Number six is focus on your strengths. Let's say you're in a group, you ask someone a question. This used to happen with us too. And then somebody knows the answer more than you. It is very normal to feel disappointed and feel like you do not know anything. Don't get hung up in situations like this. Focus on your strength. Just because other people know a little less or a little more than you doesn't make you less weaker. So focus on your strengths and hit it hard. Point number seven is starting with page one. I see this especially when you're reading a complex topic like, let's say, biostatistics. It's easy to get bogged upon all the details and starts with page one. That is probably not going to be a high yield. Now focus on how you like studying. If you want to start somewhere in the middle, that's totally fine. I've also seen people who actually start with the last chapter and they have been successful. So focus on whatever you need to do in order to achieve your strengths and improve your knowledge. Number eight, focusing only on speed. It's normal to think I have my exam coming up in the next few weeks, so I need to complete everything without trying to remember and analyze what is going on. Sure, everyone's speed is different, so make sure you don't rush, but rather take your time. Of course, you don't want to take years together, but rather an optimal time to understand all the things you're reading. So that brings to the next point. You cannot understand what you have studied. Now, how do you know you understood this? Try to grab a friend, a study group, or someone in your home where you can explain the concepts to them. If you're able to do this, this means you have a good understanding of what you have read and you're able to spit it out in the exam. Number 10 is a common problem. People tend to ignore what type of exams they're focusing on and do not pick the right type of study materials. For example, if you're preparing for your PG in your home country, you might need a different study material as compared to studying for, let's say, USMLE Step 2 or even Step 1. Now, on the other hand, let's say you're preparing for MCCQ1, then you may have to focus more on concepts like chrono notes and those concepts that are relevant to Canadian healthcare. Number 11 is not having a plan. I struggle with this a lot. I worry that if I have a plan, I'm not able to accomplish it. So what's the point of even having a plan? But it is really important to have a plan at least for a week, if not for the day, because that actually will help you focus on what you need to study during that week or that particular day. So make sure to have a plan. Number 12 is you're confused. Now we recommend for USMLE exams to focus on things like USMLE Word, First Aid, and for MCCQ1 you can focus on the same things plus concepts that are tested on the Canadian side. Point 13 is you have no goal attached to your studies. Let's say you open a book, read a chapter, you're done, and then you come back the next day you open a second book, you read the chapter, you're done. So this is called lack of goal because you do not know how you're progressing. Now focus on things like, am I going to take a study exam and am I focusing on improving my scores compared to the last time? So come up with some sort of goal so you know you're progressing in the right way. The other way of doing this is also by obtaining guidance or mentorship from people you trust. Point 14 is, I'm a big fan of repetition and revision because I cannot remember many things on the first read. So I really like going back and then revising my concepts so I solidify them. And once I read them, I also can verbalize to someone I trust so I know my concepts are very solid. So repeat, revise, and rinse. Not only in studying, but also in your exams. If you have time, I always suggest for those questions which you are not sure the answers to go back and double check and make sure you get the right answers. Point 15 is, it's very normal to compare with others and see that, oh, that person is reading a different study material. That person is going online and doing something else. Don't get boggled by these. So pick a few study materials that is relevant for that particular exams. Number 16 is multitasking. Everybody is so different. I see someone is watching TV while they're studying. Somebody is listening to music. Somebody needs pin drop silence when they're reading. So I just cannot generalize this. Everybody is so different. Focus on those things which you're good at when you're multitasking, or if you don't like multitasking, that is totally fine. Focus on a quiet place and focus and study accordingly. Point 17. Is there anything like over-reading? Now let's think of a different example. Let's say someone is interested in going to the gym and bodybuilding. Now we hear this concept about over-exercising where they get hurt and they're unable to continue their exercise. Is there any concept like over-reading or over-studying? Do comment below. What are your thoughts on? But I would say taking adequate breaks is really important. Now this brings us to point number 18. How do you get adequate rest? Because the brain needs a right mix of reading, nutrition, and rest. Make sure you take frequent breaks to refresh your energy and your memory. So let the brain consolidate all that you have studied. So focus on eating good food and getting some solid rest. Number 19 consists of how you're focusing your studies, what you're going to study on, and the study materials. The study material should consist of the appropriate study materials for that exam. The notes you're going to make is going to be very crucial as well, plus reference textbooks as appropriate. I personally prefer making notes on a book. You guys might be a newer generation and you prefer an iPad or a computer, but whatever it is, make sure these notes are very crucial for your last minute studies in order to brush up your memory. The last thing I want to say is very crucial on the day of the exam. In my opinion, you only need two things for the exam. One is an extreme amount of confidence. Sure, there is a balance between overconfidence and confidence. And the second thing is presence of mind. Now, all the knowledge you have had has been sitting in your brain for the last many months or years. You just have to extract them at the right time. So for this, focus on having a presence of mind. The day before the exam, get some good rest and then attentively read the questions and answer them, because we also have seen IMGs who are unable to complete the questions because they ran out of time. You don't want to be in that category because you couldn't finish something on time. Alright, now that you have all the killer tips to get great scores on your exams, if you need our guidance, I recommend to go to www.imgsecrets.com and book an appointment from there, and we will be happy to talk to you and guide you appropriately with your career. Next, I encourage you to watch this video where I've talked about all the options of how you can become a doctor in the USA. Any questions? Do post in the comments below. Take care, stay safe. I'll talk to you soon.